Here with more, plus answers to your medical questions, is Dr. Msonthi Levine. So is breakfast just as important for women too?
I would say so, based on my experience. I mean, and they talk about men in this particular segment, but I think so. It makes a huge difference. My own personal experience as well. I try to get a good breakfast in every day, whole grains, fiber in the morning, fruit as well. I think a lot of people skip breakfast, and then by lunchtime they're starving.
Right.
And they normally grab for something. And as
Chips.
you know, visibility, access to the processed food is a lot higher than it is for the nutritional food. So they tend to consume bad food, and they do this every single day. So I think it's important to get a good breakfast in the morning, because it kind of sets the stage throughout the day to help control your calories and help you make better decisions about eating healthier alternatives.
Does it also set your metabolism rate as well?
I think so, absolutely. I haven't read a whole lot about it. I would just have to assume so. It all makes sense. You know, we don't have to complicate this entire thing, which we like to do, but it all makes sense, and I'm sure it helps push the metabolism in a positive light to help control your appetite, burn more energy. So I think it does. Okay,
on to some of our viewers' medical questions. This person wants to know, does hydrocodone or Flexeril affect sexual activity?
I think so. This is based on some experience dealing with patients who've tried some of these medications. I mean, these are very powerful medications. We talk a lot about this, so I think it does impact sexual activity.
Okay. Is it possible for a woman's tubes to become untied after 5 years?
You know, I'm not quite sure. I think that with the inflammation produced by tube tying, that it would certainly reduce the possibility of becoming pregnant again. I'm sure there's some technique out there somewhere. Is it being done on a frequent basis? I don't think so.
If there are 5 stages of chronic kidney disease, at what stage does a person have to take dialysis?
Normally stage 5, and this is kind of an academic pursuit to put it in stages. We also use blood work to help us with that.
Why do I wake up with a high pulse rate? This morning it was like 102. It goes down a little later and then averages the 70s and 80s.
Maybe nightmares? No, I don't.
Uh-oh.
102 actually is not that high. It is categorically above 100, which is high, but it's a low high. Some things I would think about are obstructive sleep apnea, very rampant in this country because a lot of us are overweight, but certainly I would check thyroid, maybe anemia, maybe pain can also cause the heart rate to be high, but it's not too bad.
Okay. This person notices every time it's humid outside they get a rash. Can you possibly shed some light as to what it is?
You know, rashes we have to see, but I'm going to have to assume humidity. I would say the skin is very moist. A lot of us have fungal infection on our skin, and sometimes can become more apparent when the skin is moist. Sometimes people call that a heat rash. A lot of times you can treat that with over-the-counter antifungal therapy. We have prescription medications, both cream and pills.
Okay. What would cause your whole right arm to swell and ache like a toothache?
I think the thing I would be concerned about is a clot, or what we call a DVT. Sometimes the circulation, you develop that, and there's no way for the blood to drain in the arm, and so it becomes swollen, and as the swelling increases, it becomes very painful. That is a medical emergency, and certainly would recommend they get immediate evaluation.
Okay. What's the best way for a sickle cell anemia patient to work out without making themselves sick?
I mean, this is basic common sense things. A lot of times oxygen is the most important thing, but you really can't be carrying around an oxygen tank when you're exercising.
That would be difficult.
Absolutely. So I would just kind of listen to my body. Start off with basic things, brisk walk, a jog, maybe even do some elliptical, and just kind of listen to your body. I think if you do okay, there's no reason to think that you're necessarily damaging your body by exercising. We certainly want everyone to be physically active.
All right. We've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says they have had a crick in their neck since yesterday morning. It hurts when they turn side to side. They had to put ice on it. What else can be done, and what could it be?
Probably just cervical arthritis or degenerative joint disease of the cervical spine. Anti-inflammatories like Motrin and Advil work really well. A heating pad works really well. Sometimes you have to get an x-ray or an MRI, very common problem.
Could you get a massage?
Absolutely.
I'm just trying to help somebody out here.
Absolutely, massage works really well.
This person was diagnosed with neuropathy in the leg, but it hurts all over their body in the morning. What could be done?
Certainly, neuropathy can be a diffuse process, not necessarily to a certain part of the body. The diagnosis would probably have to include something that can cause that. Diabetes is one of those. But a lot of medicines on the market, such as Lyrica, Neurontin, amitriptyline, or Elavil, work really well. Cymbalta, we also sometimes use. Also, just trying to figure out what's causing the neuropathy. A lot of times we don't know.
Okay, a 66-year-old female, when bending her knee, there's a cracking sound, sometimes a popping sound. What could it be?
Good old arthritis. We see it a lot. Yeah, absolutely. I mean, it can sometimes cause the popping and cracking. It doesn't necessarily mean it's severe or that you need surgery. That's just kind of some of the sounds that occur as the knee degenerates. Again, start off with the anti-inflammatories. Glucosamine chondroitin is a component of a lot of the over-the-counter products that work really well. Some patients can try like a 6-week trial to see if it works. Certainly weight loss, good health, and anti-inflammatory medicines work really well.
This person's joints hurt all over their body. What could it be and what can be done?
Well, I think you have to think about other treatable forms of arthritis, such as gout is very common, rheumatoid arthritis, lupus, to name a few. Those are treatable forms, meaning there's specific therapy for that disease process. So I normally look at those issues when someone comes in with diffuse pain, but if it's just one joint, I tend to think of probably osteoarthritis.
A 61-year-old male, generally healthy, was diagnosed with staph infection. How does he go about treating it?
Antibiotics work really well. I think we've become somewhat paranoid about the MRSA, and we need to be, because we need to have some stewardship with our antibiotic usage. That's the reason why we're seeing a lot. But we still have a lot of antibiotics to choose. The big thing is just getting on top of it. Certainly there's sometimes a body wash that you can get over the counter, doing that every other day to kind of decrease the bacterial load so that you can reduce the frequency of staph infections, but it's very common. We see it every day.
So many times, especially during the summer months, you hear of people getting a staph infection and then they go in a pool. What do you recommend for people with staph infections getting in a pool?
I don't think it's necessarily contraindicated. Chlorine is a great killer of bacteria. I mean, I think if it's an open sore, common sense says don't get into a public water like that. Certainly get on some antibiotics, but chlorine actually knocks out a lot of that bacteria, to be honest with you.
Okay. What treatment do you recommend for chronic fatigue syndrome?
You know, that's a really tough one. Just trying to figure out what's causing it, and certainly trying to get them some energy. A lot of times we have to treat depression and also lack of sleep, which a lot of the patients with chronic fatigue have. It's a very, very tough disease to treat. It's not a complete fix, but we try to at least improve them to 56% at least.
Okay, this person smashed the top of their foot a few weeks ago. It wasn't broken or anything, but they did have a bruise. About 10 days after this, a bump appeared on the top of their foot. It's a squishy bump about a bit as big around as a dime. What is it, and should they be worried?
Tongue twister.
I know. Easy for me to say.
Hematoma. Just a collection of blood, probably what I would suspect.
So don't worry about it.
No, especially if it's not too bad.
All right, Dr. Levine, as always, we appreciate you stopping by, and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or post those questions every Monday on our KFTM Facebook page.